Hello you guys, welcome back to Tuesday Tips. This is our weekly check-in. We discuss different topics in plastic surgery and I get to answer your questions. Today we're going to talk about the shin. This is a different topic. We're talking about the face. We usually talk about breast, tummy tucks, lipo. So let's talk in detail a lot about the shin, the neck anatomy, and what are the options. Okay, so we'll start with the anatomy. What are the layers? What are the things that we can improve, and then what are the options to improve them, okay? So the neck area is a very delicate area. The neck tends to have very thin skin, and there are different layers, like in any other area of the body, that may harbor more fat or loose muscle, and then give you that appearance of a saggy neck, okay? With aging, like everything, gravity, aging, everything tends to drop. And the face is not an exception. So the face and neck area tend to age by the soft tissues of the face kind of drooping and laxity in the neck area. So rejuvenation of the neck tends to involve not only the neck itself, but also the jawline to give you more definition of the jawline, and the angle between the jaw and your neck needs to be a sharper angle, and that gives you a more youthful look. When you lose that or that angle becomes more obtuse, more broad, then it gives you a more age appearance of the neck area. The other thing is platysmal banding. So some of the muscles, some of the superficial muscles of the neck, which is called the platysma, tends to create some bands, and you may have seen that in some people, especially when you animate, you see those lines, but those lines may get very thick with aging and kind of get pronounced even when you're not animating, okay? So what are the layers? You have more superficially, and here is like a little diagram of a person looking up to the shin. So the shin area, it's like a triangle, and that area may harbor some fat in the subcutaneous space. So we have the skin, just deep to the skin, we have some fat. So you may have some excess fat in that subcutaneous plane. Then after that superficial plane, that subcutaneous plane, we have the platysma. The platysma is a very thin muscle. It connects with the muscles of the face, and it continues towards the neck, and it helps to animate the face. It's very thin, very superficial, but this platysma is the one that creates those, what I was mentioning before, the platysmal bands, and causing those lines that go from the jawline towards the neck perpendicularly. And also it may cause some bulging in the center when these muscles separate with aging, okay? So this area here, like with the tummy tuck, and we talk about the muscle separation, that sometimes happens in the neck and creates that bulging in the center because there is lack of muscle support of the jawline or shin area, okay? And deep to the muscles of the platysma, just in an innermost layer, we have all the muscles, we call those strap muscles or the neck muscles. Just in this area here and here, just below your bone, your jawline bone, there are two glands that are called submandibular glands. Those glands with aging may drop and cause more bulging in your neck area. So you may have a combination of subglandular ptosis or droopiness of the glands combined with excess fat, combined with the platysmal separation causing that bulging, okay? So those are the layers. So now that we went over the layers, we can go over the options, because these options will treat different layers, so different problems, like any other type, like any other area of the body, okay? So let's start with the non-invasive options. We love this, right? We love the non-invasive, no incisions, I can get it done in and out, and that's it. I love them too, but the reality of the non-invasive alternatives is they're good and they improve some if we're talking about very mild skin laxity, right? And very mild subcutaneous fat, okay? And the results are not going to be as drastic because the intervention is not as invasive, okay? So who are good candidates for the non-invasive? Younger patients that do not have a lot of skin laxity and they have more subcutaneous fat without a lot of skin laxity. Very mild, okay? The non-invasive options for the shin area, we have Kybella. Kybella is an injectable that dissolves fat. The problem with Kybella and why I don't use it a lot. One, it needs multiple treatments to get you a noticeable result. The swelling is very dramatic, okay? Because it acts by breaking fat, it tends to get more swollen before it gets better. So multiple injections, you're gonna see a dramatic, more than with liposuction, very bad swelling and painful because it gets very swollen, needs to break up the fat. So non-invasive, but it's actually like when you see the post-injection, that first 2 weeks after the injection, it looks even more severe than with liposuction because it needs to break up the fat, so more inflammation in the area, okay? And the result is not as drastic, okay? The other option, non-invasive for the neck area, is Morpheus 8. Morpheus 8 is a device, it's the same machine as the face type and body type that we talk a lot, but Morpheus is the non-invasive alternative. It is a combination of the microneedling with radiofrequency that it's topically used, and we can do it in the office with only topical anesthesia. Very tolerable. It does require at least 3 sessions to see a result. And how it works is with the microneedling, radiofrequency to the skin provides increase in collagen formation to improve the quality of the skin and skin tightening, okay? So this is very good, and it can be combined with face Morpheus, and you can get a full facial and neck rejuvenation in the office without the need of anesthesia or downtime, okay? More invasive options, but not as invasive, so let's call it less invasive. It's liposuction and face type, okay? Liposuction will take care of the subcutaneous fat in a more aggressive form than the Kybella with one treatment instead of multiple treatments, so the recovery is shorter. It's a small incision like this big, hidden in the chin area in the crease, so it's very well hidden, and you won't even see it unless you kind of look up and someone can very closely see if you have an incision there. But it's a very good alternative for subcutaneous fat, but without much skin laxity. So here we're talking about moderate to mild skin laxity. And if you have moderate skin laxity, I do advise adding face type. Face type, like I said, same machine as Morpheus, but the depth where the radiofrequency is working is deeper, okay? So it's a cannula that I placed through the same incision as the liposuction, put the cannula in, and the radiofrequency has been done in the subcutaneous space, which is a little bit more an aggressive type of radiofrequency, and it does radiofrequency assisted lipolysis, so it also breaks up the fat, helps with the liposuction portion, and with time increases collagen formation, skin tightening, okay? So the good thing about this one is that even though I do it under general, it can be done under mild sedation in the operating room if you're doing only the neck, but usually in the majority of my patients do this in combination with other procedures. Like they're coming for the mommy makeover, they do the chin, they come in for BBL or Lipo 360, they do this. So it's a very common add-on, and you can ask about it to your coordinator and add it to the procedure that you have already booked, okay? And we have the more invasive technique, or the surgical neck lift. So the advantage of the surgical neck lift is that it takes care of all the layers. The superficial, the mid layer, the platysmal muscle, and the deep layers, because we can even fixate and bring up the submandibular and submandibular glands to create a better contouring of your neck, okay? So it's not even, I'm removing the fat in the subcutaneous space, I'm also bringing the muscles in, which is application, similar to what we call the application in the tummy tuck, we call it application of the platysma. So bringing those muscles to the center, I divide the muscles in the mid-neck to get rid of those platysmal bands, and also fixate the submandibular glands if we need to create a better sharp angle between your chin and your neck. This obviously has a little bit of a longer recovery, but it is the most dramatic result. And if you do have severe skin laxity, I do recommend that you consider the neck lift. Okay. The thing about the neck lift is that if you do have some sagging of, so the neck lift, before I explain the facelift part, the neck lift is an incision all hidden posterior to your ear. Okay, so you won't have any incisions anterior to your ear. It goes from the lobule back in the posterior part and in the scalp area. Okay, so if you're only doing the neck, everything is hidden on the posterior ear and a small incision in the crease to do the plication or the repair of that platysma muscle in the center. But if you do have severe skin laxity in the neck, usually you also have descent of the soft tissues of the face. If you do that, which means jowls, this area droops a little and you have like a little soft tissue hanging over your jawline, it's better to do facelift and neck lift combined. The reason for that is if you only tighten your neck and you have this droopiness here in your cheeks, that is going to be more noticeable once the neck is corrected, and it's not going to look good. If you're a candidate for a facelift, then the incision will go from the hairline. It's going to be hidden in the crease just anterior to your ear, so it's a very well hidden scar, and then it turns and connects with the incision of the neck lift that I explained. From the earlobe, posterior part of your ear, back to your scalp, and the small one here. Recovery time for neck lift, facelift surgery, it's not a very painful surgery. It's usually the first week, a lot of swelling, a lot of bruising, but you're not going to feel a lot of pain. You're going to feel fairly good, a little bit of discomfort the first 1 to 2 days. I put a drain that I remove on day 2 to 5, okay? So you're not going to go home with any drains. And then when is it that you're going to be okay to go out, right? That's the most common question. Usually, makeup-wise, 3 to 4 weeks. No makeup, 6 weeks, and you'll be ready to go out. Okay. So I'll get to answer some questions now if you guys have them.
Please ask for some likes. We need some hearts here.
Okay, hearts, please. Some hearts.
Okay, now we can start with the questions. Yes.
Okay,
if I gain 6 pounds from consultation date, but I'm still under the BMI of 33, will it be canceled?
No. So as long as your BMI is less than 33.5, you won't be canceled. But remember, for your results to be optimal, you should be in your goal weight. Okay. If you try to lose weight after surgery, then your results are going to be affected. If you're doing, for example, a BBL, then the fat, you may lose it in the buttock. If you're doing a tummy tuck and you lose a lot of weight, then the skin may sag again. Same thing with the breast, okay? So importance of being in your ideal body weight so you can maintain your weight later on is extremely important so you can maintain your results.
Okay, how long do you typically feel the tightness after having a tummy tuck with muscle repair?
So the tightness, usually it's more noticeable the first 6 weeks. At 6 weeks is when you're gonna be cleared to start working out, and I do recommend stretching type of exercises. So like yoga, Pilates, that's gonna help you stretch that abdominal wall and improve that sense of tightness. Obviously, listen to your body, okay? At 6 weeks, you're healed enough that you can stretch a little bit, but at first, it's gonna feel very tight. And at first, you're not gonna be able to stretch as you were stretching before. It's gonna be a drastic and dramatic process till you can get to the level that you were pre-op.
We have a lot of questions, Doc.
Let's do it.
4 days mommy makeover post-op. It's okay to take off my compression binder to wash and dry it?
That's okay. Yes, you can take it to wash and dry. You can coordinate with your massages. So that way you're getting your massage and you're cleaning the binder at the same time so you're not off the binder for a long time.
Okay, another one. What's the proper care after an arm lipo?
So after arm liposuction, it's important to do massages, okay? That's gonna help drain all the fluid initially and also later on improve the skin contraction and tightening, okay? The compression, you're gonna wear it for the first week, is gonna be like a wraparound with an elastic band. Okay, you're gonna use that for the first week, re-wrap it every day. And when you come for your follow-up appointment, then we'll measure you for the sleeves, okay? And the sleeves you're gonna wear for a total of 6 weeks at all times, and then from 6 weeks to 3 months, you're lower it to 12 hours a day.
Can you go back to work in 2 weeks to office after a tummy tuck and breast augmentation?
Usually at 2 weeks you'll be able to if you do desk kind of work, computer work. Limitations at that time are going to be anything heavier than 10 pounds you shouldn't be lifting, and you shouldn't be doing any strenuous activity, okay? So that's not going to be possible until 6 weeks out. But at 2 weeks you should be able to be moving around and do desk work. The only thing is you may still have your drains, okay? Drains, sometimes you're still draining a lot of fluid, will still be in at 3 weeks, okay? If by 3 weeks they're still draining too much, most of the time I ask you to remove them. But at 2 weeks, you may still have some drains. So if you still are uncomfortable to go out with drains, then I advise that you wait 1 more week.
When can I start working out after a mommy makeover?
6 weeks, okay? So at 6 weeks is when the exercising and heavy lifting restrictions are lifted, and you'll be able to go back to working out.
After your mommy makeover, how long does it typically take for the lower numbness to go away?
To the numbness in the incision?
Numbness, yeah.
Oh, so in the tummy tuck, you'll see that you may have some numbness. If this is the belly button and this is the scar, you may have some numbness first in the entire abdominal wall, but usually around the incision, and that tends to get better. The numbness that you may still see for a longer time is in this area, okay? From the belly button down in the center. This numbness tends to last a lot because remember, I elevate all this skin to do the muscle repair in the center, so all this skin is elevated on the inside. So those nerves were cut during the procedure, and it tends to heal from the outside in, and this area may be numb up to a year.
Okay. If I get sick after 2 weeks post-op, can I take regular medicine?
So if you get sick 2 weeks post-op, I want to know about it, right? So if you experience any symptoms in the first 30 days after the surgery, you should notify your surgeon, okay? It's important to rule out that anything that you're feeling is not related to your surgery. You may be having some infection, you may be having seroma, any complication related to the procedure, okay? Once that is ruled out, then we need to know what is going on, right? And determining if you need to take any prescription medications or any over-the-counter medications, then we can discuss what things you can and cannot take.
After a breast lift, when can I change the surgical bra?
Surgical bra, you're gonna wear for the first week at all times. After a week, you can change it. You can change it either to another surgical bra or to a sports bra, as long as it's sipped or brushed in the front, so you don't have to be pulling it over your upper arms.
Why are you so great? So lucky to have had you as my surgeon.
I love it, thank you. You are great.
How long can a drain stay on? Mine is 4 weeks.
So if your drain is still on at 4 weeks, send us a message through Clara, okay? So most of the time at 3 weeks, I ask you to remove it, but send us a message because I'm gonna ask you for, to see how much is draining and a picture of your abdomen and the color of the drain to make sure everything is good.
Okay. How can I minimize arm lip swelling and prevent incisions from opening? Can I shave?
That's a very good question. Okay, so shaving in the armpit area, don't shave for at least 2 weeks, okay? Because you may traumatize the areas of the incisions. And at 2 weeks, you're gonna shave it very carefully and away from the incision. You can shave around it, but the incision itself, if you have an incision passing the armpit, you should wait at least 6 weeks to shave the actual area of the incision, okay? The swelling, you're gonna have to wear compression garments and try to elevate your arms. So I'm gonna ask you not to elevate the arms above the shoulders, but when you're sleeping, your arms are on your side like this. And this is gonna cause a lot of swelling in your upper arm, in your forearm area, and also your hand. So it's very good to put pillows under your arms so your arms like rest like this and they're not in the dependent position completely, and that's gonna help a lot with the swelling.
Any tips on how to recover from a male BBL? I'm looking for a masculine look, no hips. You do that?
Yes, I do. That's a very good question. So a lot of my male patients tend to be scared about the hip part. We can definitely do a BBL, just tailoring a more projection, more roundness to give you a more athletic masculine look without the adding of the hips and that silhouette, that it's more a feminine look, okay? But I do also have male patients that want that look. So it's very it's very versatile in the sense of that we can tailor it to your goals depending on your foundation, okay? So that's a very good question, and also we can discuss it in your pre-op to make sure that we tailor it to your goals, okay? In terms of, well, the question was about the recovery.
The recovery, yeah.
is gonna be the same, even if you're a female or a male. The recovery is the same because the importance is, one, for the massages and compression in the areas of liposuction to get that skin to retract and adhere very well, and to not apply pressure to the fat grafted areas, so no sitting and no applying pressure for 6 weeks.
Can my surgery be recorded or get behind the scenes pictures?
No recordings in the operating room. I sometimes do some recordings, but it's for teaching purposes, okay? Not to broadcast the surgery. It's more, if I'm showing something, I might just take short video, but I usually don't take videos of the entire surgery. But if you do ask me, I can take some pictures intra-op and I'll show them to you later on. But we always take pictures the day before and on day 5.
Well, the last one, yes. Intra corset.
Okay.
If you do the intramuscular, could be.
Okay.
We're missing words here.
Okay.
No, the internal
corset.
Yes.
For a tummy tuck, I guess. Okay. So yes, definitely. When we do the muscle repair, that's basically like creating an internal corset. It's bringing the muscles in. That's gonna flatten the belly and bring the waist in. And with the combination of the liposuction to the lipo and flanks, just gives the final touch for that hourglass figure with the tummy tuck.
Doug, how many patients do you operate daily?
Good question. I don't do more than 5. So usually 3 to 5, depending on the cases itself and the complexity of the cases, but never more than 5 cases. Awesome, you guys. Thank you so much for all the questions. Hopefully we learned a little bit about the options regarding chin and neck contouring. And remember that we are going to do... Yeah,
we should show this.
I'm laughing here because Willie is showing me the things that I need. Remember this, remember that, so I don't forget. Thank you, Willie. We're gonna do an intimate talk about labiaplasty. I do understand that in a live setting, it's kind of uncomfortable to be asking these things in this type of venue. So we're gonna do a more private session. It's gonna be Zoom, and it's gonna be only for a few patients that are interested in talking about labiaplasty, and that way I'll go over what's the surgery, the recovery, what to expect, and then get to answer your questions, okay? So if you are interested in participating on this, just DM me your email, and via email we'll be communicating with all the instructions, dates, and when to log in, okay? See you guys next week with Tuesday Tips.